Good evening, everyone. Welcome to another session of Wisdom and One Wellbeing, making healthcare work better for physicians and patients. This is a program we run as part of the New York ACB Wellbeing Committee. My name is Jennifer Heinen. I'm the chair of the committee this year. Very happy to be introducing a panel of wonderful physicians tonight who are here to speak with us about their experience as physician parents, even having written a parenting handbook for physicians and hosted multiple parenting cafes at national conferences. I'd like to first introduce Dr. Susan Lee, who we are calling Susan. We use first names tonight. She's a professor of clinical medicine at Renaissance School of Medicine at SUNY Stony Brook, medical director at Stony Brook Primary Care, deputy chief medical information officer for Stony Brook Medicine, past New York ACP governor and regent of the American College of Physicians, and also very relevant to our session tonight, she's also a mother of two. So I'm going to turn it over to you, Susan. Thank you so much for being here.
Thank you, Jennifer, so much for the opportunity to share the work that I've been doing with this great group of people. I met Sneha, who's over on my right on my Hollywood Squares, and I am very fortunate that she is a new addition to our faculty at Stony Brook. She's an associate professor of clinical medicine at Renaissance School of Medicine, and she's our newest primary care track director and associate program director of the internal medicine residency program. She also serves as co-chair for the career advising program at SGIM and is a secretary and co-chair for SGIM's Mid-Atlantic region. And I heard that you guys had an amazing conference recently, and it was I heard about all the raves of your meeting. She's a mom to one boy and one dog, and she will be co-moderating this session with me. And one of the great things about being governor is that I always had the opportunity to meet so many amazing people, but one of the things that is great is the opportunity to collaborate with others. And when Sneha reached out to me about participating in Parenting Cafe, I thought it was a great opportunity. And then she invited me to be part of this group where we collaboratively wrote a parenting handbook. And as far as we know, there's really nothing like it. So we're very excited to share that with all of you tonight. So I'm going to turn it over to Sneha to start the evening.
Thank you so much. Well, welcome everybody. So we're doing this in a parenting cafe style. So far, we have heard the word Parenting Cafe a few times. This initiative was started by Women in Medicine Commission at SGIM back in 2019, where work-life balance, which was already hanging by a thread, took a toll on everybody, especially parents who were also physicians, and managing those dual roles became even more challenging. Since then, the parenting initiatives have expanded out of SGIM. We have collaborated with New York ACP. So thank you so much for that. Society of Hospitalist Medicine. And now I think for 5 years straight, we have a parenting and medicine interest group, which my wonderful colleague Paula Marfia now leads. And we've been putting out programming on the importance of parenting in medicine and like the different topics associated with that, and sharing the wisdom of so many who have learned from, who we have an opportunity to learn from, and who have done this for so many years and done it well. So this panel is actually really special and close to my heart. So it's going to be a panel style talk with all my wonderful colleagues who have all kind of written a chapter in the book, which we'll share in the chat very soon. So welcome everybody again. As you come in, please introduce yourself in the chat. Tell us where you are in your parenting journey and what questions do you have for our speakers. We'll get to as many questions either during the talk, and we definitely have time for Q&A after as well. So let's get started. Oh, sorry, quick word about asking questions. Type them in chat or raise your hand, and then we can have you unmute and ask your question too. So our first panelist today is Dr. Diana Samberg. She's an assistant professor of medicine and an associate program director at UPMC Internal Medicine Residency Program. She's a mom of 3. Diana, you wrote a wonderful first chapter on physical health. And my questions to you is, when is a good time to have a baby, and how to stay healthy during pregnancy, especially when you're working in healthcare?
Hi. Hi, thanks so much. I think those are excellent questions and ones that I asked myself when I was in training. For context, I'm the mom of 3 children. I had one in med school, one in residency, and then one as a faculty member. So I've got to experience a lot of different times of how to be a mother and a parent in medicine. The advice I got when I asked it, and I still give to other people, is there's never a good time. And it holds true. You kind of just figure, there's some times that are worse than others, but there's really never a good time. And so ultimately, you make the best decision for you and your family that you can, and you make it work no matter when it is. Each time in training sort of has its own upsides and downsides. Medical school, you have a lot more free time, but it's less under your control, and it's kind of more pressure about figuring out what you want to do in your life. In residency, the hours are terrible and you tend to have very little control over your schedule, but there's usually enough people to back you up. And so there's nice support systems. And ultimately, you're not the one in charge. And so there is more flexibility that inherently comes with that. And then being an attending, well, we have more flexibility, but there's a lot more responsibility and more asks of our colleagues and our patients when we have to take time off for whatever reason in terms of, planning and parenting and having children. And so no matter what, it's hard, but you have to have backup systems and backup to backups and figuring out how to make things work when things go a little rough. And then I think the second question was how to stay healthy. That is an excellent question, and it's sometimes really hard to do, especially for those of us that prioritize other people more than ourselves. But especially when you are carrying a human or nonetheless, responsible for them when they're outside of your body, it is hard to do so. Generally, I say if for pregnancy wise, the second trimester, if you can kind of time hard things, is usually the best time during pregnancy. It tends to be when people feel the least bad. That's certainly not true for everybody, but sort of planning wise makes it a little bit easier. The first and the last are hard. It's when you feel terrible but you're still responsible for things, and just being open and honest with those who you work with, those who are your superiors, and then hopefully you're in a good supportive place that they'll work with you. Most of the time, patients are pretty nice about it too. They understand. Many of them have been in similar situations. And so I think the transparency and honesty is really the best. It even gets harder when they're children and then they get sick and you have to care for them and, planning for those things. Like I said, backups to backups so that you can always try and make sure that your children are cared for and you try to care for yourself. All right. Thanks.
Yeah, I think, Diana, what I think helped me was having lots of backups. Like I had my parents as backups, I had friends, families, coworkers. I had many, many backups. But great. So the first chapter was that you wrote was on physical health, and everybody will have an opportunity to look at the handbook, but you wrote a really excellent, detailed chapter about that. Our second chapter, which was a chapter called Emotional Health During Pregnancy and Postpartum, was written by Jillian, there she is, Jillian Kyle, and she's an assistant professor of medicine in the Division of General Internal Medicine at University of Pittsburgh School of Medicine, and she's the clerkship director of the Adult Outpatient Medicine Clerkship. And she's the current membership chair of SGIM Mid-Atlantic Region. So the questions that I had I had 2 questions. Why is emotional health important for parents in healthcare? And the second question is, how do you care for yourself as a parent in medicine? Those are pretty loaded questions, but hopefully you can give us some tips.
Loaded, but really important. Thank you so much. So I think the question of why is it important is it's important for all parents, right? It's important for moms and dads and everyone involved, for their emotional health, for the little person that they are growing or taking care of, and also for their workplace and their neighbors and their whole community. It's important for their emotional health to be in good space. But I think there are particular pressures for physicians that are different. We know that postpartum depression is more common in women in medicine. So if the U.S. population, it's about 1 in 7, it's 1 in 4 in women who are in medicine, right? So we know that it's more common. We also know that our jobs often ask us to downplay our own health and our own emotional health. Not always, right? Like as you were talking about, so being at a supportive place is really helpful, and having an environment where we can talk about what's going on is great, but not all environments and all specialties and all places that you are will necessarily be supportive. So we sometimes are in a job that asks of us, whether it's supportive or not, to have difficult hours, like nighttime hours, which may correspond to a baby who's not sleeping, or when you're trying to breastfeed. And those things are difficult. We also often, regardless of your point of training, often have fewer weeks of maternity leave compared to other people in professional careers, right? So maternity leave in this country is small to begin with, but many of our colleagues in other professional careers are able to take longer periods of time, with the average for physicians and residents being about 6 to 8 weeks. And that's maybe generous for some programs. And then the other things you think about is just like finding places to pump, right? Finding, your childcare options. All of that is really difficult, and we have to manage that while having a really difficult and demanding job. And I also think, why is it important? It's important for our patients, right? It's important for our patients, for us to be healthy and in a good place, and well rested. And so I think those things are really why is it so important, and why it's so tricky and difficult for physicians in particular. I think what can we do, I think gets at what you both were talking about, Susan and Diana, is in largely support, right? Support from our program, support from co-residents, co-fellows, co-faculty members, right? Support from the outside. So Susan, you were talking about all of the layers of backup that you had. And I think that piece is so important. And as Diana was saying, when someone gets sick, right? So really having those layers of support are really important. I think it can be really hard, right? So some people will choose residency, fellowship in a location where they don't have family. And so then it's up to them to find backup that is maybe a lot in a financial burden, right? So paying people, nannies, if that's a option for them, versus very expensive daycare, depending on where you live. So I think support is really important, and also can be difficult depending on where you live. I think also making a plan. So thinking about, Diana was kind of talking about timing, and it's never easy, but thinking about scheduling. Are there ways I can schedule maybe less heavy, intense rotations when I get back, if I'm a resident or a fellow, to kind of make that transition back to the workplace a little bit easier? Thinking about, are there, if mental health has been something that you have been managing over time, are there supports you want to have in place? Therapists, restarting medication, thinking about medication in the peripartum period can also be helpful. So I think having the right supports in place, thinking about what those layers of support are going to look like, and also having a plan in place with your PCP, psychiatry, therapy, all of those people can be helpful as well.
Great. Thank you.
They're actually deeply grateful for Jillian for actually writing this chapter, and actually thinking about having a chapter on emotional health as a standalone. We still think about like postpartum depression, but it's actually postpartum mood and anxiety disorder. The definition has been expanded even by the powers that may be, who expand definitions and timings, not just right after birth, but also, any mood disorder from the beginning of pregnancy to a year after delivery. So it's a big time span, almost like 2 years in somebody's life. So thank you for the spotlight on this chapter. So our next chapter was on navigating parental leave policies. This is the big one. This was written by Dr. Rachel Vanderberg, who's an associate professor of medicine at the University of Pittsburgh, fibromyalgia clinic director, and internal medicine track boot camp co-director. She's a mom of 2 sons. So Rachel, if I may ask you these questions kind of piecemeal instead of asking both directly, because I'm reading at it and I'm like, woof, it's quite a bit. The first question is, what are the challenges faced by our trainees in navigating a parental leave policy?
Sure. Yeah, thanks for the introduction and thanks for having me. For trainees, there's a lot of challenges. So the landscape is very different for medical students versus residents, and that distinction comes because one is considered a student, whereas the other one is considered an employee. So there is a lack of parental leave policies across medical schools. I would say that it's a minority of medical schools that actually have a parental leave policy. So for a lot of medical students, there's really nothing in place that they can refer to. This has been like slowly getting better, mostly through advocacy on med students' parts. Right, where we would hope it would be, driven by the leadership, but it seems to be kind of when I was researching this topic that medical students who have had kids in med school kind of spearhead the efforts to create policies at their school. So some med students may have a policy in place, but a lot of them, I think, are left without really anything. In residency, residents are considered employees, so there is usually some type of policy already in place, and then they also have to navigate kind of their residents, like the employer policy, and then their program specific policy. And I think really the best advice I could give for residents is to really understand the policy themselves and really get into kind of the nitty gritty and make sure they understand it. So ACGME has some wording around policies, but it's really the ABIM that spells out exactly how much leave somebody can take. And there was a study done a couple years ago that was looking at whether program directors could appropriately apply this leave policy, and they did very poorly. So a lot of residents were being given kind of misinformation regarding the policy and not taking as much leave as they actually could under the policy. So that kind of gets back to the advice is you've got to know it for yourself, and you've got to be willing to advocate for yourself, because nobody else is gonna do it for you. So I would say it's pretty rough out there for students and residents. I know there's several people on this panel who had kids during those time periods. I had both my kids post residency, so I didn't have to personally navigate that.
And to follow up, as faculty, how can one navigate the institutional, state, and federal policies, which vary quite a bit?
Yeah, so same thing. I mean, I wish it was different, but you need to know what those policies are for yourself. There is not overarching federal legislation about parental leave policy. There is something called the Family Act that I think is going through the legislative process and has been since 2023, but I didn't see any kind of movement on it when I was trying to look it up more recently. But some states do have federal legislation, and we have some links in the handbook in terms of where you can find these policies, like specifically the ACGME references ABIM, the federal legislation, and then you need to know your institutional policy again, and also be ready to advocate for yourself. The other general advice that we kind of gave in the handbook was to do this early, like as long as you're feeling comfortable with that, is to start the conversation early with your supervisors. Look into the policies early, get an understanding of them kind of ahead of time. So there's nothing worse than, like somebody else was commenting, feeling horrible and trying to figure this out, like when you're vomiting in your first trimester, and like trying to decode some of the language in these policies, which is not super easy to understand.
Yeah, I will say I'm a person that had my first child during residency, and I was very fortunate to have a chief resident who allowed me to create sort of like a flexible um, schedule, which was like to this day. He was actually at our chapter meeting, our chief resident, and to this day he's like my Shiro almost, because he not only did that for me, but for many other residents in our program. But back then, I guess we didn't really have a policy. It was just, you just sort of made it up on the way. But I will say that ACP as an organization, we are always advocating for better policies, parenting policies on a national level. So yeah, check out what's in the handbook because there's a lot of good information in there. So thank you so much. Um, our next speaker will be Molly, but where did your son go? I thought you were going to have a helper. Is Molly Fisher. She's an assistant professor in the Department of Medicine. She's the director of women's health of the Medicine Institute, the sub-I clerkship site director, director of gender-based medicine track in the internal medicine residency program. And if that was not enough, she's a mom of 3 boys. And she wrote the chapter on managing childcare as a physician, another loaded topic. So we had 2 questions for her to consider. The first one is, what should you consider before choosing a childcare? And then the second question is how to manage appointments and calling off for childhood illnesses. That's a lot.
I think it's really tricky, and I apologize for 2 of my 3 children joining us. My husband had to run out.
No, that's a joy.
So speaking of childcare and looking out for your children, I think it really, really depends on your situation. So my recommendation would be to think about what it is that you need and then how you're able to get that. There are a lot of options out there, everything from someone who actually lives in your house with you, someone who comes to your house each day, or taking your child somewhere else. Maybe you have a partner who plans on not working during that time and watching your child, then you really have nothing to worry about. Or you have a parent who lives with you or is coming to live with you to watch your child. So that would be more of an in-home option. Those are not the situations, I think, for most people. For most people, the options would be either a nanny, whether that person lives in your house or comes to your house each day, an au pair, which is usually a person from another country who's coming to live with you for 1 to 2 years. And they live in your house and you provide them with room and board and they watch your kids. It's an interesting setup. They're actually quite standardized how many hours of childcare they're able to provide and what exactly they're able to do. But it is significantly cheaper than having a nanny who does not live in your house. I think what most people end up doing is taking them somewhere, whether that's to an in-home daycare or a more formal daycare, which all of these have their pros and cons. So someone like a nanny or an au pair is probably the most reliable option. That's somebody who will watch your kid even when they're sick. They will be there no matter what, unless I guess they're really sick, then they won't be able to be there. But for the most part, it's the most reliable option. It's also the most expensive option. Depending on where you live, how many kids you have, what exactly you're looking for, this can range. I mean, I can't even come up with the numbers. It's probably somewhere between 25 or 30,000 all the way up to 80 or $90,000 a year. And so it can be pretty significant cost. Then for something like a daycare, the more formal ones are the in-home daycares. The benefit of that is that it doesn't depend on the other person being able to provide that care. So if the daycare worker is sick, then they usually call somebody in to fill in for them. And so you know what days they're going to be open, you know what days they're going to be closed. You're able to plan around that. And the cost is significantly cheaper. The problem is if your kid is sick, they usually can't go. And so that can be a big limiting factor. And when they're tiny and they have no immune system and it's flu and cold season, that ends up being pretty often. And so that would be maybe the least reliable, probably the most affordable. And I think daycare has its own benefits in terms of socialization. So I think it's really thinking about what is it that you need. Are you going to be the primary person who's going to have to call off if there's a problem? If so, maybe you need something a little bit more reliable, like a nanny, because that's really hard to do when you're a trainee unless you have a great Jeopardy system. Or do you have a partner maybe, or somebody else in your life who can be a backup? So I think that the theme of having a backup to your backup has already come up several different times, but I think that that's something that happens often where, you know, they're in daycare and everything's going great, but then they wake up at 5 o'clock in the morning and they have a fever and you're like, oh no, but my backup plan was my mom and my mom is on vacation. So what am I going to do? You kind of need another backup plan after that. So really thinking through the layers of help you have, what your financial constraints are, maybe, you know, culturally, socially, what is most acceptable to you? Because I think people have a lot of different feelings about who's watching their kid during the day and what that looks like for them. And trying to set yourself up for success. I think it's really tricky. Nothing is perfect, and often it costs a lot of money, which you just don't have when you're a trainee, which is a big limiting factor. And then I think the second follow-up question was, what about when they're sick or you're sick? And then appointments to, you know, even if everybody's totally healthy, there's a lot of well-child appointments. They have to go and get their shots. And how do you manage that? I think the most important thing is open communication with your chief residents. If you're a resident or if you're a medical student, with your dean or whoever it is that helps you with your schedule, and trying to make sure that you're able to get to those appointments. It may be you taking them, it may be a partner taking them or somebody else. But I think most programs would be really open if you just tell them, you know, these are the days that I know I'm going to need to do this. These are my priorities. I really want to be there for these different appointments. And that's, you know, the best case scenario with a healthy child. Those are still pretty frequent. And then, you know, there's many unexpected things that can happen with a baby. And so those appointments might actually be quite frequent. I know we had a lot of residents maybe where the babies weren't gaining quite enough weight. And so you have to go in every couple of days for a weight check. And something like that is definitely in the realm of normal, but can be very time consuming. So just making sure that as long as you feel comfortable that somebody you're talking to is helping you navigate that process.
Yeah, I think I've used every which option that you've mentioned. Daycare, I've done family home daycare, I've done nannies, I've done a combo of nanny and half day preschool and mom and dad and uncles and things of every neighbors, so every option. Yeah, and I think you just need to be flexible. And I think the other thing is just remember that you know, those couple years are tough, but they will, it gets better, right? You make it through. And I think for the most part, patients and program directors and supervisors, they understand. So I like the idea of what you said about being transparent and just being upfront. I think that goes a long way. So thank you very much.
Thank you.
I totally get the idea of backup to a backup, you know, because while maybe a little easier as faculty to take maybe like some time off, again, at the expense of canceling your patients, unfortunately. But I think the one constant messaging that I have gotten and learned is that you are the only parent to your child. There may be a different doctor who can see your patient that day.
Yep.
Which was very empowering to me. All right, so our next panelist is Dr. Kaylan Christianer. Kaylan is an assistant professor at of medicine at Columbia University. She's the medical director for primary care practice and an APD for the internal medicine residency program. She's a mom of 2 and has a cat. She wrote the very important chapter on lactation in workplace. So Kaylan, how does one prepare for the first day back at work when they're lactating? And what strategies would you recommend to be able to pump and nurse throughout the day?
Yeah, so thanks everyone for being here. Great to see some of our, co-writers in this project and others on the call. So I have two young kids. I have a nearly 4-year-old and a one and a smidge-year-old. I breastfed them both for about a year or so while working full-time as a primary care doctor. Got to know the like ups, downs, highs, lows of how this process can go. I think the first day back, especially as a new parent who's lactating, can sometimes be a little bit overwhelming and surprising. I didn't realize how much stuff and preparation was actually required before I lived it, day one. So I think if I could go back and tell my prior self some tips that would have made it even better, certainly doing some sort of dry run, making sure that you have the supplies that you need, you know how you're going to bring your like cooling equipment and how you're going to store whatever pumped milk you may have. I made the rookie mistake the first time I returned from leave to go back on a Monday and realized that then I had a full week ahead of me of like figuring this out. And so subsequently learned when I came back from my second child that I came back on a Thursday or a Friday. So I had only 1 or 2 days. I could kind of regroup on the weekend and then, refine my method. The other thing is often, especially if you're exclusively breastfeeding your child, you probably need to have a bit of a stockpile. So that's something to be thinking about, freezing some milk along the way so that when you eventually return to work, there's a little bit of a buffer there while you're pumping at work. I think strategies for the day, it really varies. You have to kind of evaluate what your work day looks like and see what is needed. There's, inpatient physicians, outpatient physicians, those doing procedures, and all of that can have a different, requirement in terms of what that may look like. I think at its core, you essentially need space. You need somewhere private. You need some supplies. Oftentimes that's you bringing supplies from home. I know many, lactating parents would have a breast pump that they would keep at work and a breast pump they would keep at home. So you're not constantly bringing things back and forth. There's different strategies in terms of how to have the actual cleaning supplies, whether you leave it all at work versus bring it back and forth. You need some sort of way to keep it cool, whether that's like a fridge that is at your actual workplace, or if you have some sort of cooling packs or ice. And, those especially who may be doing this in the middle of their day, like myself as an outpatient doctor, it was extremely helpful to have a computer in the space that I was in so that I could try and get some work done while I was pumping. So space is one, supplies is the second. And I think the third and probably trickiest part in preparing to come back is the time. Thinking about how you're going to actually organize your day, thinking in advance if, you're an inpatient provider, a proceduralist, or an outpatient doctor, how are you going to block that time? And I think something that I encountered and I think is increasingly being encountered is that employers and groups may be happy to allow you to, not see a patient, but especially in some of our systems that are increasingly RVU driven, what does that have in terms of implication on your actual productivity? So having those conversations early with your group or your employer so that you can make sure that you are not taking a financial hit necessarily by choosing to take time to lactate. And that's something that I think those of us both in the position to, do this ourselves, and also those of us who may not be, but are in a position to advocate, can be really critical, because often that's not thought of off the bat when some of these financial conversations are happening.
I'm going to Molly ask her question and then follow up.
Molly, did you have a question? Hand raised?
Sorry, nope, that was
Okay,
nice.
just support hand.
Yeah, I remember, now I don't know at other places, but I know at Stony Brook, we have actually a pod where employees can go pump their milk, or, it's like this little private space for employees. So I think we've gotten progressive, but we certainly can do much better.
A follow-up question on the RVU. Kind of the word on the street is there's up and coming lactation RVUs. Kind of what can you tell us about if they are going to be popular in prime time anytime soon, or it's going to take some time?
I mean, I think it's very much institution dependent. I can speak at least at our institution. We recently became productivity based, and this was not thought of in the first iteration, and took a lot of advocacy on the part of the physicians and faculty. So I think it's just something that, again, going into this before you're actually sitting there pumping, being able to find your community, have other parents or faculty that you can talk to about this and learn how to navigate. And again, for those of us, whether or not this is affecting you directly or not, helping advocate for some of these changes to support parents who may be going through this. But I think there's a lot of, to Susan's point, I think a lot of positive things have happened. The technology has become so much better. I think there's a better recognition of the need and importance of creating some of these opportunities for parents, but I still think there's a ways for us to go.
Yeah, 100% agree. We can always advocate for better, right? So true. Thank you, Kaylan. I'm very happy to introduce the author of Chapter 6, Navigating Early Career Challenges, another loaded topic. And it was written by Paula Marfia. She's an assistant professor at Loyola University Medical Center, and she's the lead I can never say it, nocturnist. Am I
You
saying
got
it
it.
right?
Yes.
I got it, nailed it. And she serves as the president of Society of Hospital Medicine, Chicago chapter, and coordinator of the Parenting in Medicine Interest Group through the Women and Medicine Commission at ESJA. And she is the mom of 3. So welcome. Thank you so
Yes.
much.
Thank you. Thank you for having me. This was a really good chapter for me to write. First, I'd just like to say, when you're thinking about career, I had this idea initially that I had to do everything while I was having kids. And what I realized is that your career is a much, much longer period of time than the time that you have your little children. So my oldest is 22 now, and my youngest is 14. And it's getting to the end of I mean, it will never end, but pretty soon they're all going to be out of the house, and I'm still going to have my career. And so that is the one thing that I've kind of told myself as I go along. My career doesn't have to be a linear path. It's going to ebb and flow with my life, whether you have parents that you need to take care of, whether you have children, whether you don't have children. And so the fact that we're talking about all these things is the biggest thing that is going to help you with your career, is that we can have open discussions about these things. So every single topic that we've talked about already that we have in this handbook all pertain to you being able to thrive in your career. So all of those systems, the support, and all those things that we've already talked about are all the same tips that you need to do your career. Anything that you have in your life that you can systematize, that can run without you, that is on like fast forward on the train, lets you be able to do something for your career. The biggest things that I wanted to kind of present about career, besides knowing parental leave policies and having those support systems and having the backups and the family and organization and systems in your house, is that probably the number one thing is mentorship and setting that up. Mentorship, so whether you have it in medical school, residency, or early career. So the handbook is kind of set up to first talk about medical school. That's when I had my first baby. I was pregnant in residency, so then that was kind of the next step, and then early career. But they all build on each other, and so that's kind of how it's set up. So having people who can mentor you, who are maybe other parents who have gone through what you have already gone through. And then using organizations like SGEM to actually have a mentor. So, and look for those other people. So I called it a board of directors. Someone mentioned to me that once, is that you're not going to just have one mentor. You have mentors in many different places. Some of them may not know. And then once you have mentors, some of those mentors then can be sponsors to sponsor you for different things. And that's how you get things started. And then the other part is just having a flexible work environment. So if you have to go from one job to another to find that environment, like, you can't be afraid to do that, because you need to have flexible scheduling. You need to have people around you who understand. Otherwise, it's just going to be harder. And you don't need to make anything harder for yourself. The people around you should be helping you make it easier for them. And then in the future, you're going to pass that on. So I will say, like, in comparison to 20 years ago, like, what we're doing now is very rewarding. For instance, like, I did nothing for my career path in the beginning because I had my child in medical school, and all I could think about was how I was going to get through residency and how I was actually going to be able to do this. And so some people fall into that trap, but also, like, then they start thinking that they can't have a baby. And so that also backs on to, when's the good time to have a baby? It's whenever you get pregnant, that's the time to have the baby. There's no good time, but there's not necessary. It's you're going to do in your life and for your career what you need to do at the time, no matter what's thrown at you. You don't know what's going to get thrown at you. For instance, my son, you don't know if there's going to be an illness. Sometimes you might have to your child may be really sick. They may have a developmental disorder. There's so many different things that could happen. And so just having flexibility in your life, having the mentorship, and then having your systems in place, I mean, that's what you can do. And then the last thing is, like, give yourself grace. Like, this is not easy. And just because you can't, just because maybe you feel like your career is stagnant at one point, it doesn't mean that it's not going to take off later. Okay. Your career can take off in the beginning, the middle, the late. I'm looking around, and I used to think that, well, I had my baby early, and so, like, well, it's going to be really hard for me to have a career. Well, like, all these other people are doing all these things and I'm not doing them, but I'm doing them now. And then I'm seeing other people who now had some of the support that I didn't have. They're actually doing some of those things while their children are young. And so you can do it. You can have a career and still do it. And you have so much time. Like, I still have years left. My son's 22. I still have years left in my career. And so there's no, like, time frame. There's no, like, right way. And then give yourself grace. You may need to maybe think about doing something alternative. So there is a little part in the handbook about maybe, like, alternative careers. I ended up working nights because that was how I could take my children to the doctor's appointment. That's how I could take my son to his behavioral therapy. That's how I was able to do it. Sometimes it may be taking a different position for a while. Sometimes you might need to go part-time. A lot of people go part-time, and it's okay. It's not, in the long term, going to affect your career like you think it is, because your career is a very long trajectory. If you don't have the time to spend with your children because you're working on your career early on, and then 20 years later, your children are up out of the house, and then, like, you still have another 20 years left in your career. Like, if you're already at the top, like, there's no place left to go, like, and you miss that time with your children. So really just the perspective, and it's just a perspective. Give yourself grace, flexibility, use some of the tips in the handbook, talk to other people, get into mom groups, have people around you that you can, like, talk to, and I think those, you will have a wonderful career.
Well, thank you so, oh my God, I can totally relate to a lot of what you said. Like, trying not to do everything at once, because your career is like, and you're right, it's a long time. And I would work part-time, probably, I don't even know how long, 15 years. And I, was offered many leadership positions, which I turned down because I didn't feel it was the right time, and everything worked out fine. So I love that you are describing it through that lens, and also the concept of giving yourself grace. I think that's really wonderful. So thank you so much.
Thanks, Paula. So our final chapter was on building positive relationship with leadership and colleagues. And this was written by Rakhee Bhayani, who is a professor of medicine and serves as a vice chair for career advancement in the Department of Medicine at WashU. So Rakhee is also a mom of two. Rakhee, why was it important to talk about this chapter, and especially why is it important to build positive relationship with leadership and colleagues through the lens of parenting, and how do you build a community of support?
Yeah, so I think throughout this sort of session that we've had today, there's been a thread of like the communication is really important, our community of support is really important. And just as it's important outside of the workplace, I think it's really important in the workplace as well. And sort of building off of what Paula had said in terms of talking about mentorship, there's a lot of this sort of building of your relationship with your leaders, like with your supervisors, with people around you, with your peer support. And I think it's important for a lot of different reasons. One is making sure that your needs are known. So I think being really upfront and really thinking through, like, what are some of the things that you need to be supported and thrive in your career journey, because it's going to change, right? As we talk about having our young children, and depending on where you are, if you're a medical student or if you're a trainee, if you're early career, and as you move through your career stages, your priorities change, things are going to change. And so sort of really having that, if you know kind of what you need, you can best communicate that to others. And so sort of having that relationship with leadership, I think, is important. The other part is, if you're able to communicate that, then the leadership can also help you with opportunities, right? So sort of if you're sort of ready for a new challenge, if you want to take a step back for a little while, if you need more flexibility, then they can work with you to sort of provide that support. And hopefully you're at an institution or an organization that is willing to support you and provide that. And if you're not, then you have to sort of evaluate kind of, where you want to be. The other part is really thinking through, creating some sort of boundaries for your time, right? So sort of, again, comes back to that communication and how do you communicate that? So if you have a leader who maybe doesn't know what you want and sort of asks something of you, are you able to sort of verbalize and say, this is a great opportunity, maybe not now. So maybe not a no, but not yet. This is maybe not the right opportunity for me at this moment. Maybe in, down the road, this would be great. And this is what I'm, looking forward to. Or this is a great opportunity. What are some of the things that would be taken off of my plate? And so that's another way to kind of have that dialogue with others. And then, again, the community of support outside of work, but also with colleagues to sort of help you identify ways and strategies that have worked for other people. And sometimes it's helpful within your own institution or within your clinical space, because if they've gone through it before, they kind of know, like, oh, this is the best place to go pump, or these are the people that can really help you navigate some of these challenges, and what worked for them. I know for me personally, I had both of my kids right out of training. And in my clinical space, I precepted in the resident clinic. And so even though I didn't have my own patient panel, so it was a little bit easier for me to take off, but communicating to other faculty members or chief residents that were precepting in the clinic, I was able to say, hey, like, I need to go pick up my kid who has a fever. Can you cover me on this shift and I'll cover you on the other shift? So sort of having that relationship with your colleagues is important, because I think, we're all sort of, in general, people are willing to help out and that. So I think that's why it's really important. And then as you go through your career, you have like the little kids when they're getting sick all the time in their petri dishes, someone had mentioned, and then all of their activities, right? So sort of, I feel like there's that elementary school, middle school where there's just their games and their activities you're taking them to, and you want to be there for some of their recitals or their, important games that they have, that sports and things like that are involved in. And then as they get older, there's other challenges and things that come up. But so I think throughout your career journey, sort of having those relationships are really important to build, and being intentional about that as well.
Thank you so much, Rakhee. I think it's just so important. And also, like, this can be a community of support, whether it be at ACP, SGIM, SHM, wherever you go, if there is one, join one. If there isn't one, create and lead one, so we can continue with this dialogue. So thank you so much to all our panelists for sharing a little bit about their chapters that they wrote. At this point, we'll stop the recording and open up for Q&A.